incredible speakers at the rally. And of course, we've got a live broadcast on YouTube. So if you're not watching us on linear TV, make sure you head on over and stay away from the snow if you're not already downtown. Because it turns out, I mean, I don't know if you saw that shot, but it's snow and snow pouring in. So we're glad we've got you here in studio nice and warm.
Yeah, absolutely. But, you know, the snow does not stop the marchers.
No, it doesn't.
Come out regardless, right? And as we get ready for the rally to start, we are joined by Dr. Marguerite Duane, the co-founder and executive director of Facts About Fertility and adjunct professor at Georgetown University.
Absolutely. And Dr. Michelle Stanford, the incoming president of the Catholic Medical Association, to talk about the importance of understanding women's health on the pro-life issue. Now, I know, Dr. Duane, that you have a practice. It's called MD for Life. What's that practice like?
So I have a direct primary care practice where I care for patients at every stage of life, from before birth until the end of life. As a family physician with a special expertise in women's health and restorative reproductive medicine, I help couples that are struggling with infertility, women that have experienced the pain of recurrent miscarriage. We care for the lives of all of our patients from the various earliest stages, whether their embryo is still in the womb, a child at its early stage, to the elderly person or the patient with cancer at the end of his life, caring for them at every stage.
Now, I always like to say that medicine stopped in 1973 for women. We stopped looking at what is going on with us. We just wanted to kind of medicate our ability to have children. And there are so many other issues that surround our fertility, and really women's wellness relies on that, right?
And I would actually argue that it actually stopped a decade earlier. With the onset of the hormonal birth control pill, which was touted as like an advance in women's health, it really stopped much research into the underlying causes of women's health. As women, we are so uniquely designed with this incredible hormonal cycle that's intricately orchestrated. But when we take hormonal birth control, it shuts down those hormones. And women deal with a myriad of side effects, including increased risk of blood clots and cancers, depression, so many issues. And we're not researching what are the underlying causes. Infertility is a growing problem. When I first started in this field a few years back, it was 1 in 8. Now it's 1 in 5 couples experience infertility. And it's not just a woman's issue, it's a man's issue as well. But in women, leading underlying causes, polycystic ovarian syndrome, endometriosis, are reflexively treated by simply giving the woman birth control that shuts down her cycle, as opposed to getting at the root underlying cause and treating it through a restorative reproductive approach. And at Facts, we're really trying to educate the next generation of medical professionals to change it so women can receive true, authentic women's health care.
And that's so important, too, because a lot of times you're talking about treating these conditions with hormonal contraceptives, and sometimes that starts early on. The doctors try and push that on the young ladies. And what kind of effect would that have on a young woman?
Yeah, I mean, Dr. Stanford could certainly speak to it as a pediatrician, but we see an increased risk of depression, anxiety.
Yes, and you're really not treating the underlying cause, as well as you're not talking to the girl about the consequences of her actions, which the depression, increased suicidality, all of that is very common in women who aren't, young women who aren't contraceptives.
Why do you think these conversations really aren't taking place? Do you know what I mean? Why is it I think there's a lot of misinformation, or people, parents even, aren't even informed about this?
I think there's part of it comes from the fact that even physicians may think that a young woman or a young man can't make that decision to not engage in sexual encounters, as well as sometimes they're treating pregnancy as a disease. And so that's the unintended, what they're thinking. And so I think that comes from that. But the young people want to know, and they often are very hungry to hear that. And I think with the age of the internet, a lot of times they do have the information, and they really are receptive to it.
Dr. Stanford and I actually first met when we were training as Teen Star Educators. It's a program geared to educating not only young girls, but also young boys about the gift of their fertility, how their bodies are designed to function, to help them understand not merely from a sexual relationship, but how this affects their physical health, their mental health, their emotional health. At Facts, our mission is to educate and empower the next generation through sharing the science underlying the way our reproductive systems are designed to function. The reality is, in high schools and elementary schools, they're not getting the true science. They're being told, prevent pregnancy at all costs, take the pill, it's the perfect panacea for all that ails women. They're not being given the true factual information. But as Dr. Stanford noted, our patients, our young people are smart. When we give them accurate, up-to-date information rooted in the science, when we speak the truth to them with love, ask them to hold accountability for their actions. They really can be empowered to care for their reproductive health and not need to rely unnecessarily on the pharmaceutical companies or the Planned Parenthoods to help them manage their fertility.
Right.
I joke, Planned Parenthood's name really should be called Planned Unparenthood.
Yes.
They're not about helping couples plan. And in fact, we're focused on increasing awareness about infertility and miscarriage. An interesting statistic just to share, miscarriage happens 15% of the time. Well, 15% of what? Total number of live births in a year. In 2022, there were 3.6 million live births. 15% of miscarriage is over 500,000 babies lost via miscarriage. If you look at that and the top leading causes of death, it's the third leading cause, but we don't acknowledge or recognize the problem. So we need to share the truth, the science about life begins at the moment of fertilization. We need to do everything in our power to educate and care for the child in the womb, the mother, and the father.
Well, that's certainly an important issue that we're not hearing, and we do everything that we can at EWTN to share that truth, medical, scientific, and also spiritual, and looking at the whole person. So we're so grateful for your witness.
Yeah.
Thank you.
Thank you so much.
Thank you so much. God bless.
Now let's head out to Teresa Tomeo, who is right by the stage.